to now just move to Siseko Kumalo. He holds a Master of Arts in Political Philosophy from University of Pretoria, and he's the editor-in-chief of the Journal of Decolonizing Disciplines, a journal dedicated to decolonizing disciplinary knowledge across faculties in higher education. Wonderful to have you with us, Siseko.
Thank you very much, colleague. Thank you very much. So I'm just going to basically start with an outline of the paper and then sort of dive into the paper. So the Black Archive is constitutive of works, artists, literato, musicians, poets, and public intellectuals who continued theorizing the fact of Blackness, even as they were excluded from formal knowledge-making institutions, i.e. the university. Their contributions were in large part not policed or controlled by the colonial logics that defined, and I would suggest continue to define, South Africa. It is this novelty which is rooted in marginality that facilitates new ways of thinking about historical and contemporary problems globally. In order to prove this proposition, I elect in this analysis to treat the question of COVID-19 and global health responses. My analysis is formulated in 3 moves, and these, of course, outlined in the slide that is shared presently. So in the first sense, I define the Black Archive using Dumile Feni's African Guernica as an example. Secondly, I locate the Black Archive in global decolonial traditions, showcasing how in democratizing knowledge-making practices we move towards the recognition of the ontological legitimacy of peoples of the margins, i.e. the global south. In simple terms, I demonstrate epistemic justice in action by using the Black Archive. My third and final conceptual move is in showing how an epistemically just world might be better prepared to deal with the global pandemic, such as the one we are presently facing. And colleagues, let me begin by acknowledging that yesterday was Africa Day, and as such, I will start with an ancestral salutation. Omakhunga isikhali samantungwa esawela izambe ezigcwele. Ngicelela idlozi lalabo abathathwa ngendluzula ababulawa ngesihluku nangenzondo, labo abazithola behlubukile emhlabeni obabamkhulu, labo abazithola bewela izilwandle ngenxa yesihluku nenkohlakalo yobukoloniyali. Ngicelela labo abafela bangcwatshelwa ekujuleni kwezilwandle ngaphandle kwesidima sokufihlwa ngemigomo yamasiko nobuciko akubo. As we pride ourselves in our varied African identity, firmly located in African soil, I take this time or this moment to say Happy Africa Month and Africa Day to all people of African descent across the world. So I begin then, colleagues, to sort of work through the argument in the paper. So the work that I do here continues a project undertaken with colleagues at Tübingen University in Germany, wherein we attempted to conduct an inter-epistemic dialogue through collaborative scholarly developments. Our efforts were in part a response that tried to heal, and I quote from Ramose, the violent context within which Socrates was transported to Africa as the omniscient teacher endowed with the highest competence in the conduct of a deadly monologue, close quote. This is to suggest that we, scholars located both in the global south as well as the global north, attempted to ameliorate the fissures and divides that have been written about by decolonial scholars who detail the perils of epistemic imposition as these perils relate to the people of the margins, the people of the global south. My contribution to today's proceedings seeks to highlight how contemporary responses to this global pandemic have been predicated on the historical fact of always locating Africa as the other. This imagined conception of Africa as the child who is consistently in need of the guidance of leading northern political powers produced alarming and foreboding doomsday coverage that continued to play into the historical tropes of portraying Africa as backward, retarded, and gradual, as was highlighted by Mundibbe in his critique of 1988 in The Invention of Africa. Put simply, the global debate, as we were trying to make sense of this deadly disease, framed Africa as the ailing child in global politics that was going to be the burden of those better off, resourced countries, high-income countries. It is useful, however, to note here that these resource countries have achieved this position by looting, pillaging, and plundering the natural resources of the African continent. However, I do not want to recycle old arguments here, but rather wish to detail how a paradigmatic shift, which is constitutive of the work of viewing the other as human, might assist us in thinking through global pandemics, such as the one we are confronted with contemporarily. I wish then to qualify my conception of the use of the term other, following in the post-colonial tradition of scholars like Homi K. Baba, Gayatri Spivak, and Mahmoud Mamdani. I wish to trouble how the colonized subject has always been regarded as lesser human. What do I mean by this? Duzinas explains, the alien regarded as the African, Asian, the indigent, the categorically other or subaltern is regarded as a non-citizen in the modern, or is regarded as a non-citizen and subsequently the modern barbarian. He does not have rights because he is not part of the state, and he is a lesser human being because he's not a citizen, close quote. It is in line with the thinking of Duzinas that troubles the very category of human rights as it was and always continues to be used as an exclusionary concept seen even contemporarily in the debates around the potential patenting of a probable vaccine to COVID-19. The very fact that this debate is happening in a context where African countries are indebted to institutions like the IMF and World Bank highlights and demonstrates the reality that even in the contemporary age, colonial logics that dehumanize the other still flourish in the global political landscape. That qualified the dispossession, genocides, and epistemic erasures of the other. These logics of violence continue to undergird global thinking, demonstrated in the examples I mentioned, even in cursory form in my analysis above here. This is to say that as we ponder the question of decolonizing global health, we cannot have this conversation without an acknowledgement of the violence and genocidal tendencies that continue to be perpetrated by those who birthed the human rights discourse for the purposes of delineating between themselves as human and those who were categorically other as non-human, even in the eyes of European modernity, even to this very day. This recognition of the dehumanization of the African, the Orient, the subaltern being is at the heart of the decolonial critique. Recognizing this core element of decolonization will be useful in my argument as I detail the notion of the African, the other, as possessing a modicum of ontological legitimacy. This leads me to my use of the Black Archive, and I'll ask us to move on to the second slide at this point in time. So defining the Black Archive, then using Dumile Feni's work of demonstrating how Blackness and indigeneity in the South Africa continued to think through or theorize the fact of Blackness, even as we were excluded from institutions of knowledge making. This theorization addresses the experiential knowledge or embodied those who were regarded as non-human under a system that was morally, politically, and socially unjustifiable. Concerning himself with the amorality of a totalitarian regime, apartheid, Feni depicts Blackness and indigeneity under a political system that tears asunder the fiber of Black life. Feni's work depicts in image form the analysis that I've presented in my introduction, depicted as an entity that defines the diseased soul, characteristic of an injustice against Blackness and indigeneity that has further been internalized owing to centuries of dehumanization. The artist Dumile Feni addresses three things, I suggest. First, a political system that is amoral, resulting in the institutionalization of structural oppression, a structural oppression globally that manifests as a contemporary debates around the patenting of potential vaccines to this current global scourge. Second, the artist details and analyzes the ontological, details and analyzes the ontological denial of Blackness and indigeneity that frames Blackness as subhuman. Finally, and thirdly, he analyzes the implications of this reality, derived from an analysis of structural oppression, seemingly a preemptive, colleagues, to the third component, implications, that is highlighted by his work. Feni details or deals with the dehumanization through visceral depiction of figures that simultaneously seem human and animalistic. Animality in Feni's work is negotiated through the baby suckling on the udder of a cow, with a further two beings or beasts, one as three-legged, another atop a cow, foregrounded in the image. Feni plays with the concept of past and present forms of Black life through the images that are foregrounded and those that appear in the background of his artwork. Preceding the animalistic images and depicted with a slight fading tonality that is reminiscent of an image that is falling out of view are depictions of humans, a style that might point to Feni's lamentation of the disease that is infecting Blackness and indigeneity as a result of the injustice it is subjected to. Disease in this respect needs to be seen in the broader sense of a fundamentally unjust and amoral political order, what Socrates frames as a disease of the soul in Plato's Republic, the disease being injustice. The fading figures in the background can be viewed as a depiction of the life that preceded colonial imposition, violence as well. Put differently, Feni theorizes in the composition of this image how Black ontology, the very essence of Blackness and its being, was altered and disfigured by colonial imposition. In this framework, I wish to suggest that Feni visually portrays the delegitimation, disjuncture, as well as erasure, even negation of the personhood of Blackness and indigeneity in South Africa. My reader will recall that in the introduction, I framed this as my rejection of the category of human rights on the premise of the distinction that this category instantiates within society, demarcating the parameters between those who are considered human and those who are considered non-human. In this one example, the reader begins to appreciate, I would suggest, the value of the Black archive in theorizing and thinking through the fact of Blackness. And here I am purposefully making reference to Fanon's analysis of the Black experience. To recognize the Black experience in this way portends the due deference that is required in any epistemic exchange. This is to say that it is only when we view the Black indigenous Orient subaltern being as human that we are able, in some respect, to take seriously their ways of life, their moral and ethical codes, and their contribution to the global knowledge commons. We can take down the image now, colleagues. So simply put, what I'm suggesting in this formulation are the following, right? This is to say that in the first sense, we need to recognize that we are having this debate in a political world that is already defined by the power differentials that are the legacy of colonial violence, genocidal logics, and unequal wealth and resource distribution, as has been alluded to by the previous speakers to this conference today. How then did we get here is the question. It is historical facticity that the contemporary world is what it is owing to colonial violence. It is a historical fact still that this colonial violence dehumanizes, abjects, and expunges Blackness and indigeneity from the category of human. The implications of these abjecting strategies, what Olivia Rutazibwa calls thingification, a process wherein Blackness and indigeneity is made into objects, is that whatever knowledge we might bring to the epistemic exchange, this knowledge is already dismissed and disqualified in an a. This disqualification happens owing to the fact that Blackness and indigeneity is not viewed as human. Blackness and indigeneity is reduced to a non-human in the eyes of European modernity. However, what if we conducted a thought experiment, looked at Blackness and indigeneity as possessing what I conceptualize as ontological legitimacy? This category is treated or represented by Dumile Feni in his fading figures in the image that was used previously, right? So this idea of Blackness as having humanity, in those fading images, we saw what this would mean, right? So what happens then when we genuinely or authentically recognize Blackness as human? Not merely just as part of our practices of performing political correctness, but truly taking seriously that Blackness has something to contribute to the global knowledge commons. This leads me to the consideration of epistemic decolonization as democratization. Epistemic decolonization as democratization, I would, in sort of framing this debate, I anticipate an objection to my argument at this point. Along the lines of, but how can I reject the category of human rights while embracing the concept of democracy? My response to this objection is simple. African modes of thought, moral economies, and social governance were always predicated. A case substantiated by Ifya Madume's Male Daughters, Female Husbands, a study that came out in 1987, by the way. It was only due to the perverted inversion of our social organization principles, thanks to colonial imposition, that Africa became obsessed with colonial modes of governance. Colonial imposition and the ghosts of racist, sexist, and genocidal thinking haunts Africa all to the contemporary day. However, owing to time constraints, I cannot treat this analysis here fully. In the very act of anticipating and defending my argument against this colonial object, ghosts of coloniality, right? So it's quite curious. It's quite a curious thing. To frame epistemic decolonization as democratization then suggests going or working rather towards what is called in the literature epistemic pluriversality. Now, there are, or there can be objections against this very move itself. The objection is predicated on an a priori value judgment that hierarchically arranges knowledge, suggesting that some knowledge has more epistemic authority than other knowledge systems. I'm not interested in the debates of epistemic authority, as they are Euro-Western obsessions with the ways in which knowledge is made and disseminated. Put simply, the question seeks to distract us from decolonial work, and subsequently, I pay no mind in this contribution today. The development of a pluriversal mode of knowledge making then suggests that we locate different epistemologies in conversation with each other, such that we are able to discern useful components of each knowledge system in pursuit of advancing humanity's understanding of the world. Put differently, epistemically just modes of knowledge making take into cognizance the contribution that can potentially be made by each knowledge system. This acknowledgement means the diffusion of knowledge centers such that Europe or the European metropole is no longer the sole producer of knowledge. As an example of the schema that I'm suggesting, is found rather in Patricia Henderson's AIDS, Intimacy and Care in Rural KwaZulu-Natal, A Kinship of Bones, a monograph that was published in 2011. Interrogating how the HIV/AIDS pandemic was devastating the rural social economy of KwaZulu-Natal in the early 2000s, Henderson challenges through a detailed ethnographic account our pre-given assumptions around responses to the wreckage wrought by the disease, HIV and AIDS. Inviting her reader to an intimately detailed account of the social networks and how they responded to the unprecedented mortality rates owing to the AIDS pandemic, Henderson's analysis challenges the category of orphan. Simply put, no child was orphan, a category associated with destitution in isiZulu, with the linguistic equivalent of orphan being the concept of intandane in the language. Even as children were losing parents, grandparents, kin to the disease, no child was orphaned as a result of the disease. No child was left destitute. This, Henderson argues, was as a result of the social safety nets that were established by the moral social economies that defined the community she writes about in her study. What I seek to suggest here using Patricia Henderson's work is the idea that in recognizing the other as human, a recognition that will acknowledge that if the other is human, they will have an established way of thinking, we allow ourselves a multiplicity of potential responses, each rooted in a different epistemic tradition. What does this mean in simple terms? It means that in our responses to the contemporary health crisis, we need to move away from our assumed epistemic arrogances that are rooted in racist logics that historically and contemporarily dehumanized and continue to dehumanize the other. It means the recognition of the need to respond to this challenge as a collective, as humanity. This means moving away from the fascist big men politics of bigoted racists like the leader of the free world, who frames responses to this global crisis as a competition, in doing so continually dehumanizing those hardest hit by this global crisis. These strategies of dehumanization frame responses in the crude and vulgar language of a numbers game, eliding the reality that with each new number counted as a death of the infection, as a recovery from the infection, as a positive or negative, each of these numbers is a human being. Recognizing the multiplicity of responses available to this global crisis denotes our appreciating and understanding that this pandemic is affecting lives, taking lives, and ultimately arresting. Recognizing that this is not a Chinese disease, but a disease that afflicts humanity holistically. Thank you, colleagues.